What is up, you guys? Check out this video. We're removing a toenail on a patient who's a runner. It's a permanently deformed toenail and they needed it taken away to reduce their pain so they can get back to running. All right, so the way we do this is a lot of patients come in and they think that, their toenail can be cleared or cured when it gets deformed like this, and really there's no fix for it when they become this severe. The next option is to, you can temporarily remove it and let a new nail grow in, but typically it's going to come back the same way. So in this case, we're going to permanently remove it so that they're going to be pain-free and be able to get back to running. So this is a tourniquet that we're going to put on. These are tourniquets that are disposable. They will exsanguinate the blood. So as we're pushing it on there, we're pushing all the blood flow out of the toe, and then it kind of seals off the arteries and veins so that we don't get blood flow into the area that we're working on. So once our tourniquet's on, the next step is to free up the nail plate, and that's what this is. This is a freer. We're going under the cuticle area. This is our nail nipper to remove it. Comes right off. That extra skin that you see there is just skin growth that builds up under the nail plate. Doesn't need to all be removed, but typically we'll clean that out. And then the chemical that we're going to put on next is called phenol, and that's going to stop the nail plate from growing back. So this is the phenol that goes on, burns the cells that grow the toenail to stop it from coming back. So this patient's a runner. You can hear he's talking about getting out to the Appalachian Trail. He's actually in pain because this nail's just thick, deformed, pushing on his toe. It's rubbing, causing pressure, and by removing it, he can get back to running within a couple days. You'll be surprised. A lot of patients think, oh, I'll have sensitive skin there and it'll be painful. I can't wear shoes. They're going to rub on. That's not the case. This new skin that forms is all very healthy and it doesn't hurt at all. Sometimes you'll get a nail spicule, a little piece of nail that grows back, which is just random. It just happens sometimes. And if that's the case, you can have it removed, but most people don't even complain of it. So it takes roughly 10 to 14 days until this starts to calm down. So during that time period, you're soaking it in warm water and Epsom salts, using Neosporin and a Band-Aid, and we're just waiting for that to kind of heal up. But you can run, you can do whatever you want during that period of time. I don't really restrict my patients. I kind of leave it up to them. So we do 3 applications of this for approximately 30 seconds, and that's going to stop the cells from growing. It just creates a burn. And I usually tell my patients, hey, the next day, 24 hours later, if you want to run, you're able to. If it's not painful, they're going to have some sensitivity and some bleeding, obviously, but it's not going to affect the procedure. They won't interfere with anything that we've done. And as I said, they start soaking it in warm water and Epsom salts, and they can do that twice a day for 15 to 20 minutes, or they can use antibacterial. So we're putting on Neosporin here. I don't recommend putting this much on when you're changing your bandages. This is just a large amount to kind of control the burn that we create and stops the gauze from sticking. That's why I put a little bit of a larger amount on. And then the gauze gets applied. This stops the bleeding. We do a little bit of a pressure dressing. If you're coming in to have one of these done, if that's why you're watching this, you could bring a flip-flop with you or an open-toed sandal we could send you home in, or we have surgical shoes that we can dispense and give to our patients that day. Most people like to wear their own shoes. Sandals are a little bit more comfortable than these generic, cheap surgical shoes we have. Not that they're cheap, but there's definitely not a lot of quality that's going into it. They're not very comfortable. Once this bandage gets wrapped on, we're going to pull out on our little tourniquet here, and we can cut it, and it'll come right off, and then the blood flow resumes to the foot. Check this out. These things are really neat. Snip, tourniquet's off. We're going to put on some Coban. It's a self-adherent bandage, and this patient is ready to go home. So I hope you like this video. Please make sure to like and subscribe. We're on our way to 100,000 subscribers. Doing a lot of different videos. If there's something you want to see, if you want me to do these videos a little bit differently than the way we're recording them and talking about them, please let me know. If you have any questions, drop it in the comments section below, and we'll see you around for the next video.